Thank you for joining us today for our Survivorship special topic. My name is Julie Lanford, and I am the Wellness Director at Cancer Services. We are a cancer support nonprofit located in Winston-Salem, North Carolina. And each month, Cancer Services posts a special topic video with experts in a variety of areas related to cancer survivorship and caregiving. These videos are posted on our Cancer Services website and our YouTube channel, and the audio is also available on our podcast, the Triad Cancer Connection. All survivors and caregivers are invited to join us for our special topic discussion group on the fourth Tuesday of each month at 7 p.m. via Zoom. And you can register for that at cancerservicesonline.org/register so we know to be ready for you. So today's special topic is neuropathy, and we have two expert speakers that we will be talking with. One is Stephanie Rehm, a physical therapist, and the other is Claire Salmond, an occupational therapist. They are both with Novant Health here in Winston-Salem. So we wanted to do this topic because it's actually neuropathy is a pretty common issue or side effect or concern that cancer survivors have as a result of some of the treatments. So it's a common asked topic for us here at Cancer Services. So I'm excited to have our special speakers. So first of all, I'm going to introduce Claire Salmond. And did I even say that right? Is it?
You did. Thank you.
And Claire is an occupational therapist. So we actually also had an occupational therapist on our previous month's special topic, which was about chemo brain. And my child has an occupational therapist for pediatric. And I'm going to have to say, just in the last 6 months, I don't think I ever knew that occupational therapists did so many different things. So here we are. We've got you on. And I guess I kind of want to start with just the signs and symptoms, maybe of neuropathy. I didn't tell you I was going to start with that, but I guess as we're thinking about what kinds of signs might they recognize to tell them, oh, maybe this is neuropathy? Like, I've always just heard numbness in fingers and toes. Like, is that the biggest thing, or what is your experience?
So I think you're absolutely right. It's the numbness and the tingling. It's just a change of sensation. And if you didn't have it before and you have it now and it's more persistent, then there's a change. And that's something to talk to your doctor about. And I know that we're sort of going to discuss this a little bit later on too, but it's those changes. And for a lot of people, it can start out with just, I think my fingers are numb or my toes are numb. And then it can also have pain. A lot of our patients will complain of, my hands are just painful or my feet are just painful. So it's that change in sensation from the norm that you're used to before. Okay.
So yeah, some people can experience numbness as pain, or maybe some people experience pain as numbness, whatever.
You're absolutely right. And a lot of time people will say, well, it's painful. And it's like, but I can't feel, but it's painful. And that sort of seems to be an oxymoron, but it's really not. And it's one of those things that we hear quite a bit.
Okay. And mainly in fingers and toes.
So the whole hand.
Okay.
The whole hand, extremities. Stephanie will talk more about the feet later on. I always joke that I don't do feet, but I do. But it's attached to a person. So what can I say?
Okay. So important things to keep in mind is change in sensation, however you kind of sense your fingers.
And it can be one-sided. It can be, so I've had people who haven't realized that they actually have numbness until they feel their good side and they're like, oh my gosh, it's so different one side to the other. But I think we compensate so nicely at times that we don't even realize something is numb.
Interesting. Okay. So if people typically, is this a result of chemo? Are there other types of treatments that can cause neuropathy?
It tends to, chemo is often a big factor, but there are other underlying medical conditions that can also cause neuropathy. So that's where you can sort of talk with your doctor about whether it's something that was pre-existing or whether that has now been exacerbated or whether it is part of the treatment that they've been undergoing.
That makes me think that, I used to work a lot with people who had diabetes. And that
Yes.
could be a side
Yes.
effect of diabetes. So possibly somebody could have diabetes, there's no trouble. Now they get diagnosed with cancer, their body's going through a lot of stress, and maybe that pushes some, more issues with that maybe weren't there before.
Or they haven't necessarily been as aware of it. And now when somebody suddenly asks them, are your fingers, do you have changes in sensation? They're like, oh, you know what? I think I do. So again, but what we do in therapy is we treat the condition. We're not really looking to diagnose. We're looking at, okay, these are the problems that you're having. So what can we do about these problems that you're having?
Right. Which is what everybody really wants.
Right.
They want to know, no, what
Right.
can I do about this? So tell us.
Right. So often,
what can they do about it?
So one of the big things is to talk to your doctor about it, because it may be that you need some changes in medication. I've had patients to tell me, I wish I had spoken to my doctor when this first started. But we see people in various stages of post-chemo treatment, or whether they're just having, they're going through the treatment. So just be aware that if you have numbness, talk to your doctor about it. From my perspective, I'm looking at dysfunction in the hands. So there'll be people who say, I can't put my earrings on anymore, or I can't do buttons, I can't feel things. And so there's twofold treatment that we look at. Sometimes some of the treatment interventions that we do is the ultrasound, which is a therapeutic ultrasound. It's not the actual, I'm not going to see anything, but that sort of sends sound waves into the area. And sometimes that can stimulate some sensation. Massage is good for the hands. And then I'm looking at dexterity. So a lot of people, again, will not realize that they're losing some of their fine motor manipulation. And so we'll do some testing on that and set up home programs. It's easy to pick up things, but it's harder when you're holding something and then you want to manipulate that. You've got your pills in your hand and you want to bring that and to the tips of your fingers, and then you drop it because you can't feel it. And so it's a lot of strategies. We talk about use of adaptive equipment as well. If people are having problems with strength, that's another issue. Using adaptive jar openers, not being afraid to use things. You just have to, you're trying to function, you're trying to be as independent as possible. So if you have to utilize strategies, whether that's a jar opener to be independent, then you need to do that. So those are some of the things that we talk about.
So is like, I think about people with arthritis, not being able to open a jar. Is that dexterity?
So it is, it can be strength, and it's also dexterity, because some people can hold something, but if you think about opening a jar, it's a combination of movements. And so if you're not feeling, we don't realize how much we feel. We have that sensory feedback all the time. And so it's like you're looking at these hands that you can't feel and you're thinking, I can't do this. It's like if you're out in the cold and your hands have gone numb and you're like, oh my gosh, I can't feel my hands. They're moving, but I can't really feel them. That sometimes is how I think of it. That you've lost that sort of that just fine motor control of it. And again, everybody is different. Yeah, everybody's a little bit different. And that's why if you go to your doctor and you say, you know what, I've noticed some increased numbness in my fingers, and they might say, well, let's tweak your medication a little bit. And if maybe that doesn't help, then a referral to a therapist. And I know that Stephanie's going to talk more about mobility and low extremity function, but it's never a bad idea to have a referral to a therapist. We can then assess. And a lot of people don't realize what they've lost because they're modifying their task a lot.
I see. So someone's referred to you, you can do like these assessments to just kind of see how they're functioning. And then you can tailor your recommendations based on that.
Yes. And for some people, we're trying some other modalities out too. There's some research that has said that low level stimulation can help to stimulate things. So we're actually sort of trying out some different techniques to try and stimulate those fingers.
So you mentioned like ultrasound and
ultrasound, massage, and the unit that we use is a TENS unit, which is used for pain, but we use it at a very low frequency to try and stimulate that sensation, the sensory feedback. And there are various, and it's a non medication response. So it's all sort of it's all sort of the nice thing is they don't have to have more medication when they come to therapy. So we use the modalities to help with that. And again, we'll do a grip strength, we'll do a pinch strength, we'll do a dexterity assessment too. And then within OT, I'm very interested in, well, how are you doing? How are you doing your everyday activities? And, if somebody crochets, then that's very different from somebody who works out. I'm going to sort of tailor a program. If they're like, well, I have problems with holding on to the bar, then maybe we'll go to one of my favorite websites, which is Amazon. I don't know if I can mention that, but
Amazon, you can do whatever.
Pretty much has everything. And so we'll look at, what's Amazon got that can help? And so it gives people an idea of that, because I always say to people, if you've got a problem, somebody else has had it before you, and somebody else has come up with something to try and help you. So
and you don't have to figure it out yourself.
Right.
So you can help based on what activities they want to do and what their challenges are. You can say, hey, check, there's so many different tools available to help
things. And the big thing with outpatient is we're looking at a home exercise program, because we only have X amount of minutes with you once a week. So the important thing is what you do at home. And that's sort of nice for people too, because they often have so many appointments that it's tough. And we try and sort of work with somebody. I'm like, well, this is what I think you need, but you tell me what. Oh,
that sounds great. How often, like if somebody was referred to you and you did an assessment, what's the average number of appointments someone might have for neuropathy?
It really depends. 1 to 2 times a week. I've had people coming in to 3 weeks. I've had people coming in more than that. And again, I always say to people, this is feedback. I want to make sure that you feel that you're getting benefit from this. And as I say, for some people, I've had very short sessions because they're like, oh my gosh, Claire, it's got so much better. I feel much better. And other people just take longer. And everybody is an individual. I would love to say, oh, this is the result, A to B, but unfortunately, it's not always able to say that.
Okay, so if somebody thinks they may need a referral, they should first go to their oncologist and say, I'm having this issue. Maybe the oncologist is like, let's adjust your chemo or whatever and see if it helps. And then, but if it's not getting better, they need to tell them again. I think I'd like to see an occupational therapist or
a physical
referral.
Therapist. Yeah.
And at Novant, you're at Martinet. Is that who like the cancer center typically refers to?
So yes, we have some specialized clinics within this particular setting. And usually we try and address where somebody is. So we have clinics in other places too. But normally it would be the Winston-Salem clinic here at the Martinet on Hawthorne Road, or we have clinics in Kernersville, if people live sort of further away. So it's a matter of sort of talking with their oncologist and addressing things. Now, if it's been going on for a while and they've been adjusting the medication, it hasn't helped, then I would just go ahead and say, no, would you mind referring me? And as I say, when somebody comes in, we assess, we discuss, and then that's for the person to decide whether they want to pursue it or not. So it's I always tell people it's a two-way street. So I get feedback from you as much as I give to you.
Awesome. And then if people are treated, I'm sure Atrium has outpatient therapy clinic you can go to. Or if somebody's at a different cancer center, your medical team.
Exactly. So whichever
nurse navigator, doctor, somebody should be able to figure out where you can go.
Yeah. Because I know a lot of people want to keep within the same network, and I completely understand that. I think the most important take-home point is that if you've got an ongoing neuropathy problem, therapy can probably help you. at least you can do is get a referral and then talk to a therapist about what they can do to help.
Perfect. Okay. Well, thank you so much for
you.
your perspective. We'll bring you back on at the end. But next, I would like to invite Stephanie, who we've already referred to. So Stephanie is a physical therapist, also with Novant Health, and works out of Martinet, which is a clinic on Hawthorne Road. So Stephanie, when it comes, we've done a little overview of neuropathy, but when it comes to physical therapy, what do survivors need to keep in mind for how you can help?
Right. As Claire had said, a lot of the survivors have some tingling and numbness, and sometimes something called proprioception problems, or that's your joint position sense. They don't exactly know where their feet are in space as well. And that can affect, as I said, the feet also, the small joints in the feet. And this lack of sensation in the proprioception can cause balance impairments. So can have people have difficulty getting up, moving, particularly at night. They might notice it when they can't use their eyes to help with the balance. They may find themselves a little bit less steady on outdoor surfaces, those kind of things. So with physical therapy, we remember safety is the first thing. And so sometimes we do recommend an assisted device like a cane or even a rolling walker for a short time as they're progressing on improving. And we can also work a lot with exercise and some of the different modalities, as Claire had mentioned.
Okay, so I'm learning terms here. Assisted device. So sometimes that's a jar opener helper, and sometimes it's a cane or walker.
Right.
These are like very apparently medical terms for regular things. And if anybody doesn't know, at Cancer Services, we got canes and walkers you can come borrow for free, and then you can bring them back when you're done. So if you just need them for a little bit of time, we're happy to let you use them. I know Stephanie sends people to us all the time, or sometimes she's even nice enough to pick them up for the person, I think.
Yes.
So that's a strategy. Are there other strategies that you suggest for clients?
Yes. Generally, any kind of strength training, endurance training, and exercise can be very helpful. It's been found that a lot of weight-bearing exercises, such as sit to stand, little mini squats, and even things like Tai Chi can really help with decreased tingling and balance, and decrease some of the symptoms, the tingling that we talked about, and the pain, improve balance. Working with a physical therapist, sometimes specialized balance training, such as multi-directional stepping, working with weight shifting, and working on different surfaces can be helpful. Sometimes foot exercises, such as doing an ankle ABC. Writing your ABCs with your foot can really help to get that joint position sense improved. And things like picking up marbles can actually help with developing that proprioception again, and working with that dexterity that sometimes will help with the sensation, the numbness, and things like that. The other thing is other areas is certainly education, making sure that people are regularly checking their feet, so that they notice any abrasions that might need to be looked at. Properly fitting shoes, that is also very helpful. And then protecting their feet against rubbing or heat, those kind of things, to make sure they protect their skin. So as they get better, that they're not dealing with another problem, such as some kind of skin breakdown.
Because if you can't feel your feet very well, you don't notice if there's like a blister or a cut or a burn, I guess.
Right. Some kind of thing that might cause more problems with your walking if it wasn't addressed. So certainly education is also, we do a lot of educating on those areas.
Awesome. Okay. What else do I need to ask you? So how do people know if they need physical therapy for neuropathy versus, okay, I can do my ABCs with my foot, I can pick up some marbles, I can do Tai Chi? At what point is it like, no, you really need to see somebody to help you do more?
Well, I think if you notice your balance is that you're having more near misses of, balance difficulty with turning, tripping, those kind of things, or if you're having difficulty getting up at night because you aren't able to use your vision like you do to compensate during the day. Certainly things such as difficulty on surfaces, grassy areas or different surfaces, if that cause you problems, or even things such as difficulty with when you stand up. If you have a difficult time getting your balance right when you stand up, that may be a sign that you have a little bit of difficulty with that proprioception, that joint position sense that I talked to you about, and working on having a little bit of physical therapy to work on those areas might be very helpful. Other things. Go ahead.
I was going to say, so sometimes I think the person having difficulty might not be the first person to notice they are having difficulty. So maybe if you notice that a caregiver or friend is commenting like, oh, are you okay? Are you steady? You need some help? That maybe is a sign that you didn't notice. You think, oh, this is just normal because it's just me standing up. And other people are like, you're not so steady. That you don't have to take it personally that they are trying to help you or whatever, but maybe that's an indication that, oh, something might have changed that I haven't noticed.
That's correct. So, use your family and people that are close to you as kind of to give you cues if maybe a little bit of therapy might be helpful, or things are more difficult than they should be. The other thing is that if things should be improving after people complete their chemotherapy, if things don't seem to be improving, or you're still having difficulty with managing stairs or standing up or anything, if it seems like it's not getting any better, that would be a good time to talk to your doctor about getting a physical therapy referral.
And let's say somebody is done with their treatment, so they're not seeing their oncologist as often, can they get that referral from their primary care doctor?
Yes, we get a lot of referrals from primary care. We've gotten referrals even from podiatrists, but different people. So we take referrals from all those physicians.
And let's say, I know sometimes you have to know like the right terminology. If somebody were to be referred, let's say they were having balance issues, and who knows if it's neuropathy or what the problem is. But anyway, they're having, can they just say, I'm having problems with balance and I think seeing a physical therapist, or is there a certain terminology they should be using?
No, I think balance is great. The other terminology, sometimes gait instability, that sounds very medical. But
it sure does. Yeah. Okay. Gait, which is like walking or balance on your feet.
Yes. Anything that you're standing and walking and moving, gait and balance. But that would be a great referral for physical therapy.
Okay. So last question for you, since we have the physical therapist here with us. Are there other conditions that are kind of red flags that you think people would benefit from seeing a physical therapist on? I know you do lymphedema work, which is like swelling.
Right.
What are some other things that you feel like people have some of these side effects and they don't realize a physical therapist can really help them?
Yes. Sometimes, particularly chemotherapy, particularly if you're undergoing treatments for head and neck cancer, sometimes it can affect the vestibular system, the inner ear. And so sometimes people will have problems with dizziness because it's affected those nerves in the inner ear. And so sometimes a referral to physical therapy, if you're having dizziness or difficulty turning and reading and things like that, sometimes there are exercises we can do to help kind of recalibrate that system. So that would be another area to have a referral. I would certainly check with your primary care physician to make sure there's nothing, other things like your medications don't need to be adjusted or things like that. But that would be another thing, is dizziness and some unsteadiness because of vestibular or inner ear problems.
Gotcha. Yeah. I guess someone could be unstable for a variety of reasons. It could be neuropathy in their feet. It could be muscle loss, and it could be, vestibular inner ear balance issues. Okay, so we're going to wrap it up, but I want to ask Claire to come back on as we're wrapping up, because this has been really fascinating. Actually, every time I do these interviews, I learn a lot. And I feel like I've worked in oncology for a long time, but still there's just a lot of new things that we learn and discover. So it's really great to hear from both of you.
Can I just make one quick comment, sort of reiterating what Stephanie has said? It doesn't matter when you had your treatment and what kind of treatment you had. If your function is decreased, think about getting therapy. If you're having difficulty reaching into a cabinet that you weren't before, and you're like, oh my gosh, it just feels like my shoulder is stuck, we can probably help you. You might have some stuff going on in that shoulder that we can help you with. So it's worth just saying, you know what, I think I can do better, but I feel like I'm being stopped by this, and this. But it's a physical problem. We can probably help you.
That is a really great point. But it doesn't matter if you're in treatment, recently out of treatment, or years beyond treatment.
Not at all.
If it's affecting your functioning, like I had some hip issues, and we all just want to ignore it and pretend it's going to go away on its own. But it turns out that just doesn't really. So I, had physical therapy for a while and got those maintenance exercises. I will say though, that the best results come when you actually do what your therapists tell you to do at home. So that's a whole nother behavior management, but it's nice to feel like, okay, I have some things that I can do to help with this, when oftentimes in treatment, you're just like, I can't, there's nothing, everything's taken away from me. To be able to, to given something to do can help focus your mind on those things, which is a very positive kind of experience. So
and also to know that you're not alone, to know that other people have gone through this too is a big factor in things.
Okay, so as I close out, which is what I do every time, and I ask our speakers, share one piece of advice. So you can repeat something you've already said if you feel like that's your key point. But anyway, for your last thing, what's kind of your one main point that you want people to remember as we close out our special topic this month? Let's start with Stephanie.
Okay, I was going to say, you don't have to do this alone, that we're here to help. Therapists are here to help. So if you feel like there's things that are difficult for you to do, your balance is just not where it was, you're having numbness and tingling, talk to your doctor about getting a referral. And remember, things are going to get better with over time. So as the chemotherapy leaves your body, there will be improvement.
Good point. Claire, what about you?
I guess my take home point is that it's a journey. It's a long journey. And for many people, they think that they finished their medical treatment and everything is going to be good, and it's just not. So that might be actually just one corner that you've turned. And it doesn't matter how long ago you had your treatments. If you feel that you're having deficits, talk to your doctor, any doctor, your PCP, your oncologist, about getting a referral to somebody.
It's funny how many times I ask for speakers on all kinds of different topics, their final points, and a lot of times it's ask for help. Don't be afraid to ask for help. You're not alone. People are there to be with you. So I think all of us who work in this field, we see these things. And so we want you to know we are happy to help you get whatever resource it is that you need to feel good about, where you are. Okay. So that wraps up our topic for today. Thank you so much to both of you for sharing this awesome information. It's really helpful. And I want to remind everybody, if you want to kind of process this information that we shared today with myself and/or Lindy, our survivorship coordinator, who is also a cancer survivor, we do a discussion group about our topic. And for this month, it'll be Tuesday, May 23rd at 7 p.m. on Zoom. So please register so we know who to expect. That's cancerservicesonline.org/register. And if you missed any of our previous topics, please visit our special topic webpage to check those out, or our YouTube channel. So thank you so much for joining us today for our special topic for May. And be sure to stay updated on our survivor programs by checking our website. Be sure you're on our email list, our social media channels. We hope you have a great day and see you again next month.